So while you're setting up the case, the surgeon may walk in and ready to be gowned and gloved. At that point, your responsibility is to stop what you're doing and take care of the surgeon, because the surgeon is the most important person in the room. So the first thing you're going to do is you're going to get your towel, open it up, you're going to hand it to the surgeon over the right hand and drape it across like that. The surgeon is then going to dry her arms off. While the surgeon's drying, you're going to get the surgeon's gown. Now the surgeon's gown, remember the smiley face I told you about earlier? The neckline creates this little smiley face here. The smiley face always goes to the person being gowned. So when you're putting it on yourself, the smiley face goes to you. When you're putting it on the surgeon, the smiley face goes towards the surgeon. That's how you know you have the gown oriented in the right direction. So you're going to open it by grabbing a hold of the Velcro tabs, the corner tabs. You're going to drop it and let it fall open. Sometimes giving it a little shake. At this point, you're going to take your fingers holding the corners of the neckline and you're going to twist them under so that your hands are protected from the surgeon who's not yet sterile. Then you're going to approach the surgeon, and the surgeon's going to put her hands into the arm sleeves. You're going to go up to about her shoulders, and that's where you're going to let go and pull your hands away laterally from the surgeon so that your arms don't contaminate anything. Now, many times the surgeon will just take the sleeve and pull it down, exposing their fingers on their own. But sometimes we do this to help, and we can do that for the surgeon. So we're going to grab down here, not near the cuff of the sleeve, but we're going to grab down towards their elbow, and with one pull, expose the fingers of the surgeon. And we'll do the same thing for the other side. Now, once they're like that, we're ready to get their gloves. We're going to open their gloves. We start with their right hand. We push down on the fingertips of the gloves and grab the cuff and pull it back. Holding the glove in this position, we're going to put our thumbs inside, wrap our fingers around under, and then, in order to get this opening nice and wide for the surgeon, we're going to use our middle finger and move it towards the front. Now, how do I think about this? Think about it as you're kind of flipping off the surgeon. So you're going to take your middle finger and move it towards the surgeon. That's going to open it nice and wide. You're going to hold your hand steady. The surgeon's going to push against you all the way down, and then you can release. So you're not going to follow the surgeon or anything like that. You're just going to hold your hand steady. The surgeon will push into the gloves. We're going to do the same thing for the other side. Fingers down, pull the cuff, under, flip off the surgeon. Now notice what's happening with my thumbs. My thumbs are way out to the side. That's to keep them away from the surgeon's fingers, which are currently not covered and therefore not sterile. So I'm going to hold it like this, and the surgeon will insert her hand into it, holding it tight, and I release. Now the surgeon is gloved. All right, so once the surgeon has her gloves on, it's time for her to spin and tie up this last tie. So the way we're going to do this is she's going to hand it to me. And at this point, I'm going to hold on not just to the card, but I'm going to grab the tie itself. I can do this because I'm sterile, okay? So I'm going to grab the tie itself. She's going to spin around. The reason I'm going to do this, I'm going to hold on tight, because sometimes surgeons like to spin real fast, and this can get tight, all right? This can pull right out of the card. So once I know she has it, I can release, and then she can tie herself up.